Now, the other thing that tends to happen in house fires or that people are exposed to along with carbon monoxide is cyanide. So we'll talk about that briefly too. So even though we talk about in fires, it can be in other places too. So this was 1985, not far from us in Chicago, where someone who, they may know who did it, but no one was ever arrested, actually put a bunch of cyanide pills in some Tylenol bottles, and a bunch of people died. So it kind of sounds weird, today, but if you go back to the 1980s, you could go to the store and just open up a box of Tylenol or whatever pill it was, and you just open up the cap, and there was no protective device or anything there to let someone know that, hey, this has been adulterated. You just open it up, and there's a bunch of pills. So a couple people died there. In addition to that, jewelers and photographers will also use cyanide as well too. And then there are some actual fruits where their seeds actually have cyanide in them. So a couple years ago, there's this huge movement of people selling apricot seeds because they had vitamin B17 in it, and it was supposed to actually help you and everything. Vitamin B17, there's no such thing as vitamin B17. Vitamin B17 was actually a cyanide derivative. So if you actually went and swallowed these seeds, you were actually okay. If you went and chewed up these seeds and then took them, you could actually get enough cyanide in your system. Luckily, most people didn't get sick, but there were definitely some children that ate a bunch of these apricot kernels and got sick. So there are some fruits if you chew the seeds where you can get sick as well. And then something we didn't see so much here, but you can still run into occasionally, it was more kind of prevalent in Asia, is this idea of detergent suicide. So what someone does is they kind of lock themselves in a car and they mix together some agents and make a gas in the car. Classically, it was hydrogen sulfide, and the sulfide part was in the detergent, so that's what it was called, detergent suicide. But they may also make a combination of cyanide, and the gas goes off, and so they asphyxiate and die. They put a bunch of these signs up so people know not to just go in there. But if you're trying to help them and you just kind of stick your head in there, the concentration of the gases can be so high, and these gases are what we call as knockdown gases. So when you get a high concentration of them, you just pass out, and if your head falls into the car, then you're exposed to these gases and you could die. So this is the situation where you'd want to break these windows and get away from there, unless you had the proper hazmat PPE type of gear on so that you weren't breathing the gas in here. So as I said, we don't see a whole lot of this anymore, and it luckily never caught on too much. But if you ever see this, just keep in mind there could be a bunch of cyanide in that car. And then finally, some of these acrylic nail removers actually break down to cyanide as well. If anybody were to ingest that, that's a little more delayed. It's not going to happen instantaneous, but that can happen as well. And once again, cyanide doesn't prevent the oxygen from getting into your body. Oxygen gets in, it gets to the hemoglobin. What it does is just like some things that carbon monoxide does, is it poisons your body to actually use the oxygen, and it poisons it here in your cells in the electron transport chain. So oxygen gets in, you just can't use it for anything, and that's why you die. And so once again, since it's going to be heavily oxygen-dependent organs that are going to be symptomatic first, that's what you're going to see. So you're going to see bradycardia, hypotension, loss of consciousness. Eventually they'll start seizing. Patients will get tachypnic because all their body knows is that they're not getting enough oxygen. The body can't tell the difference between not breathing in enough and their cells just not being able to use the oxygen. So they can get some tachypnea at first, so they can be breathing very quickly. Sometimes their heart rate and blood pressure can be elevated, but eventually they're going to get bradycardic, hypotensive, stop breathing, and then eventually die. Once again, this is also associated with kind of some cherry red skin with it too, but just like for carbon monoxide, it's not a reliable finding either. And just to give you an idea how quickly this can happen, this is another case. So this gentleman here was being convicted of arson, and you'll see he goes and either swallows something or a pill or some water, and he quickly passes away too. So you'll see how quickly this stuff can act.
Just minutes after being found guilty of burning down his Biltmore area mansion, Valley businessman Michael Marin collapsed in court and was dead just a short time later. Deputies say it appears that Marin put some sort of substance in his mouth right after that guilty verdict was read.
We, the jury, duly impaneled and sworn in the above entitled action, upon our oaths, do find the defendant, Michael James Marin, guilty of arson of an occupied structure.
Moments after the guilty verdict was read, defendant Michael Marin reached into his bag and fiddled with something for about 6 seconds. His hands then emerged, screwing the top back on a Gatorade bottle. Seconds after that, he appears to put something into his mouth. Next, he seems to chew on something, and then...
Your Honor.
Seconds later, he collapses onto the floor. Outside, Marin was whisked into an ambulance and rushed to a hospital, where he was pronounced dead shortly before 3 o'clock Thursday. Marin was convicted of purposely burning down his $3.5 million Biltmore mansion in 2009 because he couldn't pay the mortgage.
All right. So classically, I know you may not have these tools in the field. You'll see when you get to the hospital, people ask about the lactate and ABG and VBG. But what I wanted to focus more on is this idea of bitter almond smell. So cyanide's classically associated with this bitter almond smell. Keep in mind, only 30% of people can actually smell that. So it's great if you smell it, and so you know that there's warning to get away from that. But just because you don't smell it, you know, most of us will not be able to pick up that odor. So there's two types of treatment for this. There's the nithiodate classic treatment, which was in the Eli Lilly kit, and there's the cyano kit. So what this consisted of, three things. So it consisted of little amyl nitrites, otherwise poppers. People actually use them to get high, and it's aphrodisiac. It'll consist of some injectable amyl nitrite, as well as some sodium thiosulfate. And we'll talk about this is not the greatest idea, because what you're actually trying to make is methemoglobin with it. And that's how you detoxify the cyanide. The problem is methemoglobin, you can get very sick from just that. So what we use more now is this hydroxycobalamin, which is a precursor of vitamin B12. And when this combines with the cyanide, you get cyanocobalamin, which is just vitamin B12, which is non-toxic. This stuff is unfortunately more expensive, but used in Europe for years and years and years. And this would be the preferred treatment. And to give an idea of why this treatment isn't such a good idea, we'll talk about what happens if you're in the fire. So if you're in a fire and you have, a quarter of your hemoglobin is carboxyhemoglobin, so a quarter of this hemoglobin is now useless, and you have your oxyhemoglobin here. So let's say you're able to oxygenate all of it, so you're perfect here, so about 3/4 of your hemoglobin is actually working and has oxygen. If I give you so if I give you this treatment here, which has all those nitrates in it, and I make about 20% methemoglobinemia, which is what you need, all of a sudden now I've basically cut half your hemoglobin off. So it's basically like bleeding half of you to death, and you can get really sick from that. If I drop, how much of your hemoglobin actually works that quickly, you can get really, really sick. So this is why we don't like to use this kit here, because it can cause all sorts of problems there. And especially if you're already anemic, and so let's say you have a baseline hemoglobin of 10 and I cut that to 5 all of a sudden, your body's not going to handle that very well. So if this is the only thing you have, then this is the only thing you have. But because of what it's actually cutting off, how much of your hemoglobin it's making toxic, it can be quite problematic. So that's why we recommend this hydroxycobalamin. It's a lot less toxic. You don't have those problems. What you will have, just in case you've never given it, it does tend to turn you red, which is why I have this slide being red. So it turns your skin kind of red, your tears can kind of be red, urine can kind of be red. The biggest thing pre-hospital to keep in mind is that because everything is kind of red, the pulse oximeter doesn't pick up very well. So just keep in mind, if you give it to someone, your pulse oximeter may have some difficulty being picked up, but other than that, it's pretty safe, and there's really no downside if you're concerned. So who should I treat with these things? If you have someone that's working in a lab and you don't know why they collapsed and they're collapsed and unconscious, a lot of labs use cyanide-like chemicals in them. Comatose fire victims, if they're hemodynamically unstable after a fire, some suicides and they're comatose and you don't know why. But really, you can break this down even further and say if you're concerned that there could be cyanide on board and they're really, really sick, I'd have a lower threshold to treat those patients, or at least call for help to see if you think they need to be treated. And if they're not sick, so if they're talking to you, breathing, everything else is going fine, then that's probably someone that can wait and doesn't need emergent treatment. And we've gotten kind of a lot of this knowledge from France, who's done some very good work looking at this. All right, so we'll quickly talk about a little bit about some of these synthetic cannabinoids, so the fake pot and fake marijuana, just because these things keep changing. So these are just chemicals. They're clear chemicals. What they do is they spray them on basically herb-like material so they look like marijuana, but they can really look like everything else. And in order to stay one step above the law, they constantly change the chemical structures, which is why people can have very different symptoms from time to time, and they're not always the same type of symptoms. So this is someone who used some of the synthetic marijuana and actually had a head bleed after they were seizing. And what you can see here is the arteries in the brain were spasming, and so much so that they had a hemorrhagic stroke. These are bath salts, which are very similar, but same type of thing. Initially, people were getting very stimulated and pathomimetic. So this is a patient that actually jumped out of a car. He was so sick and had to be heavily sedated in the hospital for 3 days. This patient had a seizure 8 hours after they smoked some of this stuff. But even though we talk about people being stimulated, a couple years ago we had a bunch of people that were very sedated. They were bradycardic, were unconscious, some of them needed to be intubated, and they also had some of these synthetic cannabinoids. But once again, they had changed the structures just enough to keep them ahead of authorities that they actually caused all these different symptoms than what would expect. So it flooded in February and March of 2016. I know at SLU and at Barnes, we were getting literally hundreds of these patients over those couple of months. And more recently this year, some of you may have heard, people started just bleeding. And 2 people actually bled to death, and they didn't know why this was happening. It started in Chicago. And so eventually they were able to link it to, once again, the fake weed, synthetic cannabinoids, K2, spice, whatever you want to call it. But people started to bleed, enough so that this was sent from Ohio. And they talk about 70 cases in Illinois and a handful of other cases. For whatever reason, it didn't come that much into Missouri, but I know SLU had a couple cases at least. And basically what it is some of these synthetic cannabinoids, they actually had rat poison in them. So if you look at some of the rat poisons, it's actually a warfarin or Coumadin-like substance that lasts for a long time. And so these poisons actually had them in them, so people were actually bleeding to death. We still have no idea exactly why they were placed in them, but they were. So it's just something to keep in mind that when you see people exposed to some of these things, they may be developing new and different symptoms all the time, just because either people are putting poisonous substances into them, or just as they try to stay ahead of the authorities, they change the chemical structure just enough that they cause all sorts of different symptoms from how these things act in the body. And while we're talking on that, with legislation that was just passed, we are probably going to start seeing a lot of toxicity from just regular marijuana, because instead of it being about 3% marijuana, some of these things are 19, 20% or even more have marijuana in them. They can be hard to tell. These were gummies that have marijuana in them. These are candies that all look like they have marijuana in them. What makes it difficult is one candy may be meant for 4 people to eat, but someone's just going to eat the full thing, and they can come in anything. So Pop-Tarts, Cap and Chronic. So this is a 4-year-old that I saw last year. So he got into some edible marijuana, started acting kind of funny. His UDS was positive for marijuana. A couple hours later, he starts doing okay, and they're actually about to discharge him when he goes into asystole for about 15 to 16 seconds. And it was all from what we think just kind of these edible marijuana products. And there's cases throughout the literature. So this is a 21-year-old with heart disease, but he was smoking a lot of marijuana, and so he'd have these syncopal episodes from getting bradycardic from it. And then this was a case series from Denver where a bunch of kids got into these edibles, and they got very sick. A bunch of them needed LPs and head CTs. Some of them got admitted to the ICU, and a lot of these were from eating these edible products. So we're going to start seeing this more and more and more, likely with these laws that have passed. I'm not trying to say if they're good or bad, just saying either way the consequence is people are going to be exposed to them. And this isn't just like your parents' marijuana or what was available in the 70s or 80s and 90s. This stuff is a lot more concentrated and can be a lot more toxic. And we'll end this thing with talking about some of the opioids, because I want to make a point at the end about this that kind of gets very confused in the media and makes people very scared when they don't really need to be scared. But if people weren't familiar, these are some of the numbers we're talking about. So more people died in 2016 from overdoses than died in the Vietnam War or at the peak of the AIDS epidemic. Now, of these 62,000, about 2/3 were from opioids. Life expectancy decreased for the 2nd year in a row, and I think it's actually the 3rd year in a row. And the last time in the United States, and the last time that happened in the United States was like 1962. And they think this life expectancy decrease is pretty much all from the opioids. This is more Missouri data. You can see how many people are dying, and more of it is heroin. But in addition to heroin, this is going to be all those fentanyls or other synthetic opioids that are now in our heroin supply. And we know they're all around. It's becoming more and more fentanyl and less heroin. So before it was some heroin with fentanyl in it. Now we're basically having fentanyl with a little bit of heroin in it. So very, very deadly. And this just shows you all these different types of synthetic opioids that are out there. This is just a couple of them. This is some person who purchased hydrocodone for back pain on the street, passed out, actually required Narcan, and when they actually sampled her, they found a bunch of things in her blood, U47700, fentanyl, that were not actually, that were these synthetic opioids that weren't supposed to be there. So just as I said, we're winding down to kind of my last point with all this. But just remember that you may need higher dosage of naloxone, but that doesn't mean everybody needs them. Methadone will actually respond to 0.04 milligrams of naloxone sometimes, and we know that's a very potent opioid. So even though you may need larger doses of naloxone, you can still start low and slowly titrate them up. You guys are very good about this. We struggle with this in the hospital. You guys are good about giving people IN naloxone and IM naloxone because these patients may be difficult to get IV access on, or they may have a bunch of clothing on them. So you guys are actually very good about using those types of things. As we tell everybody, bagging is what's really needed while these things kick in. The other reason is if they're not breathing, the CO2 in their system may be very, very high. So even if you reverse them with naloxone, they may still be out of it for a little while because their CO2 is very high, and that has to be washed out. And we think the higher their CO2 is, that may also be associated with post-reversal pulmonary edema, which we're seeing some of as well too, even though we don't know the exact cause of it. But the real reason that I'm bringing this up is because of this. So when this stuff started being publicized of carfentanil and these super fentanyls and synthetic opioids on there, there's all this stuff about improper handling of carfentanil and fentanyl-related compounds has deadly consequences. And this idea propagated that you could just touch this stuff and that you could get really sick from it. And we don't have any actual evidence, and it doesn't really make sense that just by touching the fentanyl on your skin very shortly that you could actually get sick from these things. But I say that because this actually came from my Twitter feed on the 18th of this month, so we're talking about 2 days ago. So from an emergency medicine conference, and said an opioid so potent, even cutaneous exposure can intoxicate them. I didn't show you all the replies to this. I'll say, no, this isn't true. But you see this all the time. So someone supposedly touched a piece of paper and got very sick. Most of the time, these symptoms are not consistent with opioids. They're, sprawling on the ground. They're tachycardic. They're tachypnic. And everybody that's listening to this probably knows that when we're talking about opioids, we're talking about them being very sedate and not breathing. So they're not getting those type of symptoms. But you get people worried enough that they're putting on hazmat type suits and everything, and making people afraid of taking care of these patients. And once again, we know with these patients, if they're not breathing, really minutes is the difference between getting someone back neurologically intact versus someone back with permanent neurologic deficits, or someone that is just dead and we can't revive. So if you have any questions at all and want to actually see this stuff for yourself, this is a gentleman here. He's actually someone I know. He's done a lot of work in the community. And you can just go on Twitter. Here's the feed here. But if you just kind of Google Chad Sabora, Twitter, and fentanyl, this video will come up. And what he did here is he basically took fentanyl and carfentanil and put it in his hand. And you can sit there, see him, and he sits there and talks while it's in his hand, and he's not getting sick or anything else like that. So once again, kind of demonstrating that just it touching your skin should not make you sick. And then there's this position statement from the American College of Medical Toxicology and AACT as well. It was signed on to by these two organizations. Since then, it's been expanded to other organizations, and other groups recently also came together and made a video basically also saying what's in here, basically saying that we don't have evidence that this just touching your skin will make you sick. Basically, you just need the normal gloves that we have, and that should protect you. And if any of this gets on your skin, just quickly wash it off. But the best evidence that we have is that just from simply touching this on your skin, you shouldn't get sick. And once again, if you think about it, drug companies spent billions of dollars making fentanyl patches. And the whole idea is they spent billions of dollars to figure out to make a patch so that fentanyl could get absorbed into your skin. And if it was just so easy that all they had to do is sprinkle some fentanyl on your skin for you to absorb it and get sick, they wouldn't have spent billions of dollars developing a patch. So we have a lot of evidence showing that just simple touching your skin is not going to make you sick. Once again, if it gets on your skin, just simply wash it off with soap and water. And if you take care of these people with just your normal gloves on and your normal PPE, you should be just fine. So with that said, I know this was a lot. I know we talked about a lot of different exposures. If you have any questions, feel free to contact me or Dr. Shu. He can get in touch with me. In addition, if you have any other questions about other toxic exposures that you could be involved with, please let us know. I'm happy to talk to you about those as well.